Welcome, everyone. I appreciate you taking the time out of your very busy schedules to be with a very special guest of the AAA tonight. I'm very happy that this is one of our ongoing programs that our staff has been hard at work at maintaining during this very interesting time that we're all living through. I also want you to know that the AAA has been hard at work this year. We have been very honored to have been able to raise and send to Australia over $2.2 million US to Australia to assist in the fire relief programs. In addition, we're right now in the process of evaluating a new round of scholars from Australia to the United States. And we are very excited that many of them are also very interested in medical research that will be instrumental in helping us defeat this virus that we are now facing and hoping we can tackle in the near future. But our special guest tonight, I'm very honored to introduce, is the new ambassador from Australia to the United States of America, the Honorable Arthur Sinodinos AO. Arthur has had an amazing career. He has been a wonderful leader. Public service of over 40 years. Most impressively, I'll just do a short summary. He served with Prime Minister John Howard back in 1996, first as his senior economic advisor, but then promoted to his chief of staff. And that was a position he held for the Prime Minister for 9 full years. An amazing run in a very high intense pressure position. He also began his career before that as a career senior executive with the Department of Treasury in the Australian government. He's had numerous private sector appointments, including Goldman Sachs and National Australia Bank. But I got to meet the ambassador while I was the United States ambassador to Australia. And he was then the Senator for New South Wales in Australia, which position he held from 2011 to 2019. But while I was ambassador, he was doing an outstanding job as the Minister for Industry, Innovation, and Science. He is in my opinion, one of the most important strategic thinkers that Australia has produced in this generation. And we are so honored that he'd be with us in this very tough time. As a new ambassador coming to the United States, he's come aboard facing 2 very serious challenges. First, the firestorms in Australia, which have been taking a terrible toll across the continent, and now facing a pandemic that is circling the globe. Ambassador, we're so honored to have you here today. I'm going to turn it over to you, and we'll give you as much time as you want, and then we'll jump into questions.
Well, thank you very much, John. It's a pleasure to be with you. Thank you for what you're doing in putting on this particular webinar. And I'm gratified that we've got so many Australians and others, over 300, who are tuning into this. And can I say again to the AAA, thank you for everything you're doing under your leadership. You're taking the AAA to the next level. And let me segue from where you finished. You talked about, I came here just as the bushfires were finishing in Australia. And in fact, my first official duty was to go to the airport and meet the coffin of one of the brave firefighters who'd lost their life in an airplane crash. And I met the widow on the tarmac, and we received the casket, and I promised her that the Australian Embassy and our consular staff here in the States would do whatever we can to help. These are the bonds that bind us, the fact that when people are in trouble, on either side of the Pacific, we get together and we help each other out. It's true mateship, but I'm particularly conscious, having only been weeks in the position, the coronavirus hit, and I was struck, being a long way from home myself, how it must feel for a lot of Australians who are here working or who have been here holidaying, who suddenly find themselves stranded. They suddenly find this plethora of rules about what they can and can't do, whether it's can they go home, can't they go home, if I stay here, is my job safe? If I've got issues with my job here, even though it's in the US, can the Australian Embassy or the consulates here help me? If I want to go back, what happens if I've got a foreign partner? What happens X, Y, or Z? People have so many questions. And in a time of heightened anxiety, which I feel personally, having been someone who's been sick in the recent past and having known what it's like when you're feeling vulnerable, when something like this comes along, and you feel concerned for yourself, you feel concerned for your family, you feel, therefore, an empathy, I think, for others who are going through all of this. And so I guess for me, this has been a bit of a baptism of fire of understanding how the embassy and the consulates work on the front line when they're dealing with the needs of our fellow Australians. And I've seen a lot of work being done to help Australians on cruise ships. Now we're looking at how we help the crews who are on the cruise ships, Australian crews, to get home. We've been working on how to keep the supply chains open so that medical supplies can flow from Australia, and where possible, we can also provide medical supplies into the States. So we've been trying in every way possible to provide information through our various websites to keep everybody informed about what's going on. It can be frustrating sometimes because progress can take a little time when it comes to organising flights, getting things done. We're doing what we can on that front, and it still frustrates me that we don't always have the answer straight away to someone's query, but we try and work it through. We've got consular staff who are working literally 24/7. I know because I see the emails that come in very late at night, first thing in the morning. There's a lot of work going on. We're asking people to be patient with us, and by accessing our websites, Facebook, Twitter, Instagram, Australia and the United States, Smart Traveller, we try and provide as much information as we can, and we try and respond to as many individual calls as we can. We're trying to do a bit of business as usual as well, John. We're talking to the administration about policy issues. We're also seeking, where possible, to shape and influence the response of the US as it looks to how it deals with other countries during this crisis. For us, a particular priority in that regard is the Pacific, particularly the South Pacific, and how we can work together with the US. We both have important interests in that area to help the people in that area to survive not just the potential health effect, but also the economic effects. So there's a lot to do, and today is an opportunity to for you to ask me about what's going on and how we can help, and also we can respond to some of the questions which have been posed to you as we go along.
Well, Ambassador, thank you so much. And again, my hat is off to everyone on the team. I know I share your pride in the amazing work that the consular teams are doing, and I also have seen that 24/7. You know, each of them have families that they're concerned about as well, but they are putting the public safety and public interest first and foremost, and are really, you know, putting their shoulders to the wheel 24 hours a day. So all of our hats are off and our hearts are open in gratitude to the amazing job you and your team are doing all across the United States and for your professional colleagues in Australia. Well, Arthur, you mentioned that this has been a tough start in terms of your tenure, and I appreciate that. And I know that your wife, you have 3 children who've come with you, 3 young children, and your own battles in health that you have wrestled with, that you referred to, you know, have proven that you have amazing resilience. And that resilience right now is something all of us could use some more counsel and advice on. Are there any things that you feel that helped you to strengthen that resilience in facing the previous challenges that you faced, and now that you face it not only as an ambassador but a father of 3 and a proud husband? So is there anything you could offer as counsel to our listeners that might help them with sustaining and building their own resilience?
Thanks, John. I won't bore people too much with a soliloquy on what I went through. Just the bottom line was I had a non-Hodgkin's lymphoma, which required chemotherapy and a bone marrow transplant about 2 years ago. So I spent a period of hospitalization, having the chemo, and then recovering from that after the bone marrow transplant. What I think got me through was, apart from the doctor saying the prognosis was good, even though it was stage 4, was every day I just focused on what did I need to do to get through that day. What were the things I was having to do? What was the treatment? How do I maximize the prospects of the treatment going okay? So I tried to keep negative thoughts at bay by just focusing on the routine of the day. And I think it's very important at a time like this when we can catastrophize because of the insidious nature of this COVID-19 virus, which, you can get off someone who is asymptomatic, right? And some people can have a light impact, others can have a very heavy impact. And I know this really plays with people's minds. All we can do in these circumstances is say, well, okay, I can't control everything, but what is within my control, let me try and do what I can to look after myself. And so that's why it's important in all these things to follow the rules when it comes to social distancing, when it comes to all the other ways of safe hygiene and all the rest of it. It's important for us to just have in mind that and just focus on doing that. And the other thing I found which was useful was if you've got work to do, that's a good way to compartmentalize and not have to worry about other things. So when you're in the moment, focus on the moment. The other thing I did when I was sick was I also, every day I tried to do at least one thing I really enjoyed. So every day there was a nice memory. And also the other thing it taught me, now that I look back, is we're often in a hurry to get things done and like have one job and then go on to the next job. Enjoy the journey. It's not just about the final destination, it's about the journey and taking time during the day to enjoy the day. But the most important thing is to be able in your own mind to be present in the moment, focus on the moment, and not allow negative thoughts and catastrophizing to take over your mind. Very important.
Ambassador, I think that's incredibly great and helpful advice. I would add my own thought there too. Is I think I endorse everything you said, as well as staying in touch with those you love. And
yes.
I think checking in, especially when you know that people are friends or family members or neighbors who are alone, and making sure they have a line of communication. And a wise person told me once when I was going through my own personal crisis, when you're dealing with tough times, don't be afraid to occasionally spoil yourself. And I think that was you hit on that with your story of be kind to yourself amidst this. Give yourself a treat. Don't worry about the ice cream. You can work it off later. So thank you so much for that, Ambassador. Appreciate it. Well, I know you mentioned also all the amazing consular, the pressures that you're getting on each consulate across the entire country. And I know the demand has been so intense. The phone calls, the visits, the emails, the traffic has just been immense. And I wondered if there might be some broad themes that you and your team, your other consul generals, might have called out that you think might be of help and could more broadly answer some of the concerns that many of our people online today might have. So is there any key messages that you'd like to get out to either Australians or Americans who are listening?
I think one key message is make it a routine to check the websites. Not just once every so often, sort of on a day-by-day, every second day sort of basis. Check the websites and just see what's coming through, because there's a whole heap of information. We have a COVID-19 portal as part of that, which gives you insights into what's being done on COVID-19, both in the US and in Australia, for example. So That's the most important thing, is to have that sort of information so that people are able to lock in to what they need to know. I'm just having to go back into my device here. Sorry about that. But that's the most important thing. The second thing is not to hesitate to ring up as required, okay? It's very important for people to understand that we're here to help people out there, and people will think that their query is maybe something they shouldn't bother about. But if it's really niggling them, they should reach out. Now, obviously, when it comes to doing things like passports and other activities, we're focusing on the most urgent cases first. So the more business as usual or not as urgent cases of passports, renewals, and all the rest of it can wait. But our point is, you may think you have a silly question, but it may not be a silly question. You may be actually articulating something a lot of people are thinking about. Don't hesitate to lob in an email or a request for information, and we'll do the best we can.
Thanks, Ambassador. You know, we were talking just before about how here in New York City, we're hoping that we are either at or very near the apex of the challenges that New York is facing. And though over 750 people are still unfortunately dying every day, the good news for at least right now is that emergency room admissions and 911 calls have been significantly declining in the past recent days. And so we're hopeful that we're at the apex. And if so, it means that we might have been able to, if you will, flatten the curve, or at least bring the curve down a little bit from what it otherwise could have been through some of the social distancing measures that have been taken. I know Australia has been one of the leaders in the world on that approach to flattening the curve, and that you and the Prime Minister and Greg Hunt, the Minister for Health, an outstanding leader, have been working hard on that in Australia. And I was wondering if there were any lessons learned that you or the cabinet might have uncovered that might help the United States right now, or if conversely, if you've been able to learn something from what's going on in the United States that you've been able to take back to Australia.
Well, I think something we've all learnt from this is that we should take scenario planning for these sorts of events as a given, and that we from now on need to understand what are the gamut of things we have to do to be prepared for these sorts of situations. I don't know if you remember back to the global financial crisis when there was talk about the fact that it was a black swan event. It was one of those events that had such a small probability attached to it. It was a bit like the black swan sort of event, and therefore people tended not to think that it was very likely to happen. And yet these things are happening, and we've had warnings about these pandemics. So this has been a wake-up call to all countries that these preparations, even if they're a bit like insurance, you pay insurance for a lot of years and you think, why do I keep paying this? And then one day there's a payoff. And it's the same here. I think we've got to be able to now seriously consider our biodefense strategies and how do we build them in to business as usual as we go forward. I think that's one of the lessons we're all taking out of this. There's been a lot of focus on how international institutions work in this situation. The WHO is an example that's come up just recently. If this means that we're engaging more now in those organisations to make sure that they're match fit and working properly for these sorts of situations, that's a good thing. That's part of sensible scenario planning. The thing I think that partly helped Australia is being an island continent, we can to some extent fence ourselves off, and we took early action to do that. And indeed, the US took early action in relation to entry of people from China. But once we took that early action, it was then reinforced by the Commonwealth Government and the states working together on a series of measures to try and introduce safe distancing, safe hygiene practices, ramp up our medical supplies, our medical equipment that was required. And this worked quite well. And most of our cases have tended to be because of the import of the virus rather than domestically transmitted. And of course, once it becomes domestic, it can be passed from person to person domestically. So the action we've taken has meant that we've bent the curve, and we seem to be succeeding because we've had 6,500 cases, 63 or so deaths. That's 63 too many, but for our size of population and compared to other countries, it's been a big effort and it seems to be paying off. But what's good is that the government is not backing off. We're continuing to put the pressure on things like social distancing, looking at whether we have progressive opening up of facilities based on and services based on whether we can track people in the population, track the virus, track who may be symptomatic, and therefore really get ahead of the curve on this. We're getting there. We're not there yet, but if we can get the multiplication rate below 1, because when it's above 1, it can just keep multiplying exponentially ultimately. But if you get it below 1, there's a prospect over time you might actually get the virus to almost die out. So there's still a way to go, and there's a sensitivity about when restrictions come off, because there's a debate going on both in America and Australia about when an appropriate vaccine will be available. Now in Australia, we're putting a fair bit of money into vaccines. We've already isolated some of the potential ingredients, if I can use that layman's term, for vaccines, and we're happy to work with, and we've offered this to the US, to work on further research on vaccine development. So for me, the big lesson out of this is scenario planning, and don't think things may not happen, because they do, and you've got to be ready for them.
You couldn't be closer to a long-term truth there, Ambassador. Thank you. I remember in my first year in the Obama administration back in 2009 of being called, while I was Director of Office of Personnel Management, being called to the White House Situation Room and then the Cabinet Room as there was a great fear over H1N1 and the potential of its, the directions that it might take. And it was also an eye-opening experience for me, that's where I first learned of just how amazing the Australian capacity in vaccine research and discovery, and how deep the expertise in Australia is in that regard, because I remember at the time we were all struggling with how quickly a vaccine could be both developed and produced. It's one thing to come up with it, it's another thing to produce it so that it can be widespread. And there was a great partnership even back then between the scientists in the United States and Australia, and it was an amazing thing to watch of just how quickly our scientists were able to break down walls and barriers and share information and genetic codes and other things. It was very inspirational, and it gave me great hope when I think about listening to you to where those same efforts are ongoing today, and even deeper and more broadly. Turning back, if I could, Ambassador, I know we heard a number of questions from people, and you've talked a little bit about the closures, the border closures, the flight closures that Australia has very wisely put in place to protect its population, and the results are very gratifying. As you said, I think the curve that you have pushed down and flattened is a very impressive result so far. And though any amount of death is a terrible thing and a terrible loss, your numbers right now are looking pretty darn good to someone who's sitting in New York City, as I am. But many of the questions we received was how long do you think the government is thinking the closure of the Australian border might last? Is that something that those discussions have begun, or any information you might be able to share at this point with our listeners?
There are discussions going on about when particular restrictions might be lifted. In fact, there's a meeting today, Australian time, of the National Cabinet, which is the Commonwealth Government and the state governments, to talk about some potential measures in that regard. I don't think border restrictions would be lifted for some time. I think it'll be more a case of sequencing the restrictions that are taken off, and with a focus on internal restrictions in terms of reopening more of the shops, reopening more of industry, and so on and so forth. And in fact, there's a commission that's been set up, a COVID-19 commission, to work on what the Australian economy might look like as we come out of the virus. And that's going to be important work. And that's a sequenced process. But as I indicated earlier, the predisposition of the Prime Minister, the Health Minister and others has been to safety first, which is we're still wanting to make sure we bend that curve as much as we can. And so it'll be some time before a number of major restrictions come off. And it's also been mooted within Australia that it might be that certain states take off their restrictions first as a bit of a test lab to see how things go. Because the thing we're all concerned about is, okay, we might get the cases down to a very low level, but then as we ease restrictions, is there a possibility that the virus returns? I think we're lucky that the virus seems to be one that only mutates very slowly. So that's giving us time to develop a vaccine. The concern would be if restrictions are lifted prematurely, we may find that we get a second outbreak. And not only is that not a good thing in itself, I think psychologically it would have a bit of impact on people as people sort of just shrug their shoulders and say, well, does that mean we've got to go back into complete lockdown? So it's a very, very difficult exercise. That's why the debate here in the US has been very interesting about the trade-off between health policy and economic policy in terms of determining how long can the lockdown go, how much economic damage is sustained as a result, but when is it safe to start reducing the lockdown measures. So it's still a way to go yet, John.
Well, I think, just to quickly turn to some of those economic issues, I think, the health issues, as you rightly prioritize, are the most important, and the public safety is the most important. But the economic impacts are severe in both of our countries and around the world right now. I guess with the predictions of sort of a worldwide recession, that's going to hurt a lot of people as well. And I know that right now there's over 11,000 Australian businesses that sell and operate and do business in the United States of America. And I suspect that many of them might have employees who might have tuned in today. Are there any advice that you would give to those businesses in Australia that how to approach the United States, or how they might be able to weather this downturn, and which we hope will be a short one, but it's hard to predict at this point?
Well, for businesses within Australia, the government is providing a number of measures of support, both cash flow assistance to businesses, subsidies for the wages of employees. We're also providing, through the Reserve Bank of Australia, liquidity support to the financial system, so the banks in turn can support businesses with cash flow difficulties as they get through this period. So businesses in Australia, which maybe have a US interest, should look very closely at their eligibility for those sorts of payments within Australia, and they can, through our websites, they can get access to that information. I think this is also potentially a time of opportunity for Australian businesses to think about whenever you have a recession, without in any way trivialising the severity of it, it also provides an opportunity for things to change. And it's an opportunity for enterprises to think about, well, where will market demand go? What are the areas that are going to be expanding? One area we see as expanding, for example, is medical equipment, medical supplies, research related to medical and pharmaceutical matters and all the rest of it. That whole health sector, where Australia does punch above its weight internationally. Look at Commonwealth Serum Laboratories, now CSL, which is top of the Australian Stock Exchange in market capitalisation. That was previously a government body. It's now a very successful private body. We have these sorts of companies, ResMed, who now are here in the US, Cochlear, the hearing implant people, all these examples of companies in that particular sector. But my point is, going forward, think about what the future may look like and how you can position your company accordingly. Some companies are already doing that in the manufacturing sector, where they've been rejigging their production lines from their usual activities onto providing other medical equipment and supplies that maybe in the past they hadn't been involved in doing, but they've been able to retool for in the short term. So think about those opportunities, and the Australian government also provides export assistance and other forms of assistance to companies to do this sort of thing. I think for Australians working in the US with US companies, think about Australia as a base for the region, for the Asia Pacific. Very important to do that, particularly as coming out of this crisis, there will probably be more focus on Australia diversifying even further its trade and investment flows, and that can provide additional opportunities for Australian companies, including companies here in the US that want to use Australia as a base. It was Rahm Emanuel, former Chief of Staff to Barack Obama, who once said a crisis is too good an opportunity to waste. And I think that's right now. And we're seeing in a lot of areas, for example, where we've had to relax certain regulations in order to encourage licensing of medical practitioners, for example, or other cases where we've had to relax some of the red tape around exports of particular products, that it may be possible in this newer world we can reduce excessive red tape, which also stands in the way of getting things done. There's a whole series of possibilities people should look at. One other thing people should have in mind is that certainly the Australian government, the impression I'm getting from where I sit, very focused on how we further promote science and innovation, and how that breeds in, or how that also leads into promoting the Australian manufacturing sector to be more diverse and be more of a smart manufacturing sector.
Ambassador, a good example of that creativity between both our countries. When New York was in a tough place about a week and a half ago, where we did not have enough ventilators at the point to handle the amount of people who needed them, ResMed, one of the companies that you mentioned, an Australian company that makes great products. I know some of the creativity from some of the nurses and doctors in the United States were able to use that product to help many people who are having difficulty breathing that didn't need exactly a ventilator, but could be hopefully kept off the ventilator by using the ResMed product. So it was sort of a war front creativity that really combined the economic ingenious of both our countries and solved an important problem and got us over a very sticky hump here in New York City.
It was John, it was a good example of ResMed benefiting from the US government deciding to proclaim under the Defence Production Act that 6 companies, including ResMed, that are in the ventilator business, obviously should have access to the supplies they need, the various parts they need, because it's a complex supply chain to put ventilators together. And they told, ResMed here in the US told me they were very grateful that was the case. And that meant they were able to do more here in the States. And at the same time, they've been able to amp up their production in Australia 2 to 3 times. So in no way did that Defence Production Act being proclaimed disadvantage their Australian operations, but it helped them to do more here in the States.
Well, I tell you what, there's a lot of New Yorkers who are very grateful. So there'll be a good glass of Shiraz waiting for them when they visit here. I think one of the best lines I heard while I was ambassador was, nothing says she'll be right like a good glass of Shiraz. So
absolutely.
Well, now, if I could use our remaining time, Martha, to ask you a few of the questions. We've compiled and compressed some of the questions we've received over the past 48 hours from the audience. Could you provide advice on the entry of citizens, permanent residents, and passports? I don't know if you have anything short or that may be a very long question, but if there's any good advice you could offer in any of those areas, it'd be wonderfully, and people would be very anxious to hear it.
No, clearly, Australians wanting to come back to Australia, citizens, permanent residents can come back. There's no problem in that regard. In fact, a few weeks ago, the Australian government encouraged Australians abroad to come back home. And if you go to our website, there are details on how that process can work. Now, what was the second part of the question? It was... passports as well, I think. Yeah. Look, when it comes to passports, if people have an expired passport, that's not a barrier to getting back. We can sort that out. If they go to the website, they'll find information on that. Their airline may have to get in touch with domestic authorities to get that sorted out, but that will be on our website. I mean, this is all about helping people to get home if they feel they need to get home, depending on their circumstances here. I know there are Australians living here in the US who have had to weigh up whether to go home or not, and a lot depends obviously on your personal circumstances. But for those who feel they need to get home, we're doing everything we can to facilitate that.
Well, I know many Australians plan far in advance for the Christmas holiday and the Christmas break, that being the start of the summer season in Australia. And I know many people think that far ahead to make their plans, especially if they have Australian family here in the U.S., that they want to get home for the holidays. Do you think re-entering Australia, I know we're looking far over the horizon there, but I know that'll be on a lot of people's minds. Is that something that you're already thinking about, Arthur, and you might be able to offer people some advice?
I think people should wait a little while and just weigh up the circumstances. A lot depends on how the lockdowns and other social distancing and other measures are being implemented, whether they're coming off or not, because that may impact on people's capacity to get around when they're back in Australia or to travel around Australia. So at the moment, I would take a cautious approach to that. It's again, just safety first in the circumstances. We're as keen as anybody to get tourism going again in particular, and we're conscious of the impact that this has had on the tourism industry, and we've put out an industry support package to help them. But at this stage, we're cautious about when we'll be encouraging large groups of people to be coming back for travel-related purposes.
One of the things people might want to think about too is, I know just in reading the latest information here on the airline relief, one of the industries in both our countries that's suffering mightily, and a number of the airlines are offering for people who purchase, I think it's before the end of May, you'd have to check that with each airline, but if you purchase your ticket by a certain point, you're allowed to change that date or change that to another time. Should, for example, the situation in Australia not allow you to enter, then you'd be able to move that flight without penalty or additional cost. So it might be a good idea and a good time to look at some of those opportunities that are being offered now as those companies are looking for every business angle they can to try to get through the storm. We got a lot of questions, Ambassador, about E3 visas and looking also at Australians who want to come towards the United States. Is there any help or advice that you have for people who are looking, who are in Australia, who look to visit the United States and either on visa status or on special entry or other programs?
Well, people on E3 visas, if they're overseas, have every right to return to the US. I don't think they'd be stopped from coming back. Obviously, people on E3 visas are going through some issues. Some people have lost their job. They're thinking about going back and all the rest of it, and we're helping those people as best we can. But if you're on an E3 visa and you've got a job here and you're overseas at the moment, clearly you'll be able to get back here. And if there are any queries, they can go to our website to work those out. It's the same with other visa categories. They can just go there. But if you're holding a valid visa, you should be able to come back to the States if you have a reason to come back.
Emergency flights.
Yeah.
We've got a number of questions about emergency flights. We got when might flights be expected to go to a more regular schedule? And interestingly, a couple of questions as someone who had to fly with a pet for my term as ambassador. There was a question about whether there might be a flight to Melbourne for those traveling with pets. So I don't know. Those are three separate questions. So emergency flights, potential for a regular schedule, and flights with emergency flights that might allow pets.
Sorry, I don't know whether you heard that. It was my daughter looking for her iPad charger. Look, on emergency flights, apart from the regular flight by United out of San Francisco to Sydney, Qantas and Virgin have been running flights once a week from LA to Brisbane. And regular flights, I think, are still some way off. That will really depend on broader decisions around the lifting of border restrictions. In relation to pets, the situation is that the pet quarantine centre is in Melbourne. We don't have regular flights to Melbourne or any flights to Melbourne at the moment. So it's very hard for us to get anything done about pets except advise people to do the best they can to look after or quarantine their pets here until such time as we can reinstate flights that go to Melbourne. If there's, I guess the stance that we're taking is that the flights that Qantas and Virgin are doing at the moment appear to be sufficient for the demand that's there. The government will have to judge whether more flights are required. But as you can understand, from the point of view of the airlines, they're going to cater to the demand that is there in consultation with the government. And a lot of this, I don't think, will be ultimately solved until we lift border restrictions. That's when air travel can return potentially to more normal levels.
And going back, if I could, to just a little more detail that you might have, Ambassador, about some of the financial assistance programs. We received a number of questions about Australians in terms of how they might apply to Australians in the U.S. We've had questions about job seeker, JobKeeper, and drawdowns on superannuation. Are those areas that you might be able to offer some counsel on to people, those programs as to Aussies that might be here in the U.S. And how they might apply and how they might approach those?
Well, the JobKeeper and related assistances for businesses in Australia, but people can check on the Tax Office website for further details about that. And in the case of the job seeker subsidy, the Centrelink website, which is now My Services Australia. In relation to superannuation, if you are in the States and you have super in Australia, you can draw it down. Just go to the ATO website for information on this, or mygov.au for information on that. So you can draw down on that. It's 10,000 this year and 10,000 next year. Of course, I can't give you financial advice as to whether it's an appropriate thing to do. You have to think about that. And the tax, it's not meant to be taxed, but you need to check the tax implications anyway in case it has an impact for people who are taxed in this jurisdiction or other jurisdictions. So again, the government websites are the place to go, but start with our Australia and the US website, and we'll navigate people through on those issues.
Well, Ambassador, I'll tell you, one of my personal experiences was I was always amazed how Australia, which is an amazing country in every way, but one of the most important ways is how you all have no lack of amazing leadership at every level, whether it be medical research, whether it be business leaders, and whether it be government leaders. And I just want to thank you for taking the time today as a great example of that leadership. And we're so glad to welcome you here to the United States. I know you're going to have a very impressive tenure, just as you've had magical tenures everywhere else that you have served. We look forward to the great things you're going to do here to advance the important relationship between Australia and the United States. And the American Australian Association stands ready to help you in every way that we can. So with that, Ambassador, I'll give you an opportunity for some closing remarks. And then I think we can wrap up for the evening and get people back to their dinner tables.
Thanks, John. Just very briefly, thank you again to AAA for hosting the webinar today. And thank you to the people who have stayed on the line while us two boring older gentlemen spoke. We couldn't put on more of a song and dance act, I'm afraid. My last point is, please check what I'm saying against our websites just to make sure I've got it right. And there's a lot of detail to go through potentially, and this really is my final message. The old Paul Kelly song, where we talk about we're all in this together. I think it's Paul Kelly. People can correct me on that too. But that's the point of what we are here as an embassy and consulates. We're all in this together. Thanks very much, John.
Can't imagine a better way to wrap up. We are definitely all in this together. We can't thank everyone in Australia on behalf of all of New Yorkers who are going through a tough time now. I can't thank you enough for the amazing phone calls and outreach and support that we've received, Arthur, from all across Australia. And as one New Yorker, let me just say thanks on behalf of the other 8 million of us, how grateful we are for everything you all have done to lift our spirits and to show us that we are in this together. So God bless you, Arthur, and thank you so much. I was just corrected.
It was Ben Lee. There you go. Thank you.
Good on you. Okay, well now we'll get people back to that glass of Shiraz, and she'll be right. So thanks again for joining us tonight. Thank you, Ambassador, very much, and thanks to Gabby for your great technical leadership. We appreciate it very much.